So how is flu spread? Um, which differs a little bit, but pretty much any respiratory viruses that you see are going to be spread in aerosolized droplets, right? So when you cough or sneeze, or even you breathe, you're breathing out water, and that water vapor has um, cells infected with this virus. And so we see that there are particular times during the year that we see this outbreak, and we are recommended to get flu shots or flu vaccinations based on algorithms. We'll talk about that more in a second. That predict how the flu is going to work in between October and March, right? So the season is this period, and they really suggest that you become vaccinated in October into November, but it's never really too late. So maybe it's April, or I'm sorry, February, and you still haven't gotten your vaccination. Well, it's not too late, right? And so we can see a decrease in transmission if we get the vaccine even in February. Okay. So a little bit more about the flu virus. When you get it, you don't know that you have it, and so it begins incubating for a period of 1 to 4 days. Okay. And we see that this transmission rate can vary quite considerably. Okay, so you are able to transfer the virus 1 day before the symptoms even present. So before you know you're sick, you are still spreading the virus. Once symptoms start to kick in, you know that you should be quarantining yourself to prevent spread. This differs in children. You see up to 6 days before symptoms actually arrive, you can see that children are able to transmit the virus. Okay, and then we also see 4 to 7 days after symptoms are present, you are still able to spread the virus, right? 10 days in children is what we see, and so we see that children, because they have really an inferior immune system and is able to generate the adaptive immunity and the response, okay, that children are more susceptible towards spreading the infection. Okay. We see that in immunocompromised individuals that transmission can really occur up to months after, right? So if the virus is able to live in your body because you're immunocompromised, then it is able to be spread via aerosolized droplets. So who does it affect? Everyone. Everyone is at risk for getting the flu or influenza virus. But if your immune system is healthy, it's going to probably shorten the duration that you're sick. It's going to reduce the chances of even getting it. Okay. But we see populations of individuals are more susceptible towards infection, like children, right? They have their immune system is developed. Remember, the thymus is still developing over that time, and thymus is where T cells mature. Elderly individuals, so getting old is not always the best. We see that immune function is depressed in elderly people. Okay. It's no surprise that immunocompromised people are in here, because now they don't have the inability to generate an immune response. We also see that obese people are at a higher risk of getting the flu. Okay. So what are the manifestations of the flu? I think we're all pretty familiar with it, but fever, headache, chills, dry cough, right? So it's non-productive cough. The chills are because your body is resetting its temperature, right? So you're going to have a fever, and in order to generate this fever here, you need to feel cold, right? So that means that your body's detecting a lower temperature of your body, right? So you might not have a fever, and you still might have the chills, right? So it means that you're above what the normal operating temperature is, which is 37 degrees Celsius. Okay. But right now, you want it to be up closer to 101, right? And your body will feel cold in response to that, because then you start shivering, you get the body up, and then once you reach that optimal temperature, you might start sweating, right? So you get chills followed by sweating. we see that we have several other conditions here, manifestations, body aches, nasal congestion, sore throat, and here's the sweating, right? So we see fever, chills, and sweating. And the reason we see that is because you set your body temperature at a higher rate now, or a higher temperature. And so in order to reach that higher temperature, we get chills, okay? And the chills will generate muscular contractions. And so the muscular contractions are going to increase body temperature. And then you eventually reach this new temperature at which we shut off things and you shut past it really, and you begin to sweat as a result. Okay? And so it's a negative feedback system, but it's a negative feedback system that has been altered, and it really feels uncomfortable. The last two manifestations are malaise, which is just not feeling well. You feel sick. You feel like your body has an infection or it has something in it, so it shouldn't be there. And oftentimes you see vomiting and diarrhea as a result of this. So how do they diagnose influenza? Well, taking a medical history and physical examination. And so they're going to ask you, have you been exposed? Okay. And if you say yes, it's probably a pretty good sign, right? And so they can test for the actual, so if you actually have an influenza infection, and so sometimes you don't, but you have a fever and you have various conditions, you have vomiting, and this could be due to another viral infection. And so in this, you go to the clinic, they run a rapid flu screen. Okay, so this flu screen looks for antigens of the virus. Okay, so the virus has antigens, it has cell markers. And so we see that you have antigens, and that's what the rapid flu screen is testing for. And it is a colorimetric assay. So essentially all they do is they stick a cotton swab about an inch into your nose. They twirl it around a little bit. Be careful not to touch the roof of your mouth, which is going to have probably bacteria in it. But we want to look for this virus and this virus only. And so then we go and then we go through a series of steps running that sample. And it either comes back positive or negative for influenza. It doesn't tell you what type of influenza it is. It just tells you that you have influenza. Okay, so you might have A, B, or C. The most common form of influenza this flu season is B. If this comes back positive, okay, you likely will do a flu culture, right? So when you take a nasal swab, okay, you take this, you put it in a medium, you grow the virus up, okay, and then that can tell you what type you actually have. Do you have A, B, or C? And so this culture is going to tell you a little bit more than the rapid flu screen, but the rapid flu screen tells you if you are infected in the first place. How are you going to treat influenza? Well, there's not really too much treatment other than antivirals, and they don't generally like antivirals. Antivirals are pretty rough on your body. So we treat the symptoms for the most part, and we try to provide support to make you more comfortable. Right? So we could use antiviral medication if maybe it is type A and it is severe, to reduce the outbreaks of it. But in general, we won't take the antiviral route. We'll increase fluid intake. So you increase fluids during a flu because you have vomiting and you have diarrhea manifestations. Rest, obviously, 3 to 4 days rest is generally what is suggested. And then to take care of the symptoms, we might use flu medication, right? Which is just analgesics and antipyretics, cough suppressants, and then expirants. We treat the symptoms. We try to relieve the uncomfortableness of this. Now, it's not going to relieve everything, but it might improve the situation a little bit more. So the primary goal of all this the main treatment of this is to prevent the infection from even occurring, right? Through hand washing, avoiding crowds, and then primary prevention, right? So vaccination. We want to decrease the transmission of the respiratory virus. Avoiding crowds, is recommended when we have epidemics occurring and when we have pandemics like coronavirus. So we want to reduce our susceptibility to actually gaining the infection. So we see that vaccinations take the form of 4 types for the seasonal flu. Right? There's also other cases like swine flu and avian flu. Swine flu is able to transfer us. Avian flu is not. And so, but for seasonal flu, we see that 4 types of vaccinations are present. We have regular vaccinations that the majority of people get, and these are made from inactivated virus, and so it's not a live virus that they're actually injecting into you. Okay? So when people say they get sick from the flu vaccine, that is false, right? Most likely you had an underlying condition, or you're just reacting to the immune response. Now you're not actually infected with the flu. Okay? You're developing antibodies for the flu, but you're not actually having the flu. We get a high dose on which elderly individuals oftentimes require this higher dose to kind of encourage their immune system to act a little bit higher, and so that's 65 and older. Intradermal doses is when they inject the virus in the skin, and this is going to be 18 to 64. Okay. And then intranasal. Right? Intranasal is the flu vaccine that they actually inject into your nose. And so this is from the ages of 2 to 49. Right? And so some of these, so the regular vaccine, so for children, they oftentimes recommend getting a vaccine without preservatives, and then the same for pregnant mothers, right? So preservative-free vaccinations. And they base these vaccines on models that predict what the flu will look like for the upcoming year. They don't know what the flu is going to look like, but they're making a prediction, and these predictions have been fairly accurate. So if a large part of the country is getting vaccinated, it'll be a low flu season. And so there are live infections, live vaccinations as well. Those have a little more complications because you are injecting a reduced but live vaccine into your body. So that is the end of this audio lecture. I want to encourage you to read through your book. They elaborate a lot more on the different types, the vaccines. To keep this section kind of short, we're going to kind of hold information here. So that is the end of the audio lecture. Until next time.